So just to remind everyone on why we are looking into this, because it is a top priority for ERN to achieve interoperability, and they intend to verify PROMs data sets because they are vital tools in capturing information related to patients and to provide better care. And next. So just to be sure we're talking about the same things, or that you're all aware that PROMs are questionnaires measuring the patient's view on their health status, but the PROs are the patient-reported outcomes. They are the outcomes directly reported by the patients without the intervention of the healthcare professionals. But there is another one called the patient-centered outcome measures. And so as you can see, there are lots of definitions, and so that's in itself a challenge. Next slide. So just to give you a summary of what happened during the first workshop, we had a great attendance, lots of ERNs were represented, and lots of different functions: data scientists, project managers, healthcare directors, clinicians, EPAC representatives, and patient organizations representatives as well. Next. The stakeholders represented in the talks. We had a talk from a patient organization, from Elizabeth Room, the World Duchenne organization. We had the perspective of FAIR expert, Mark Wilkinson, gave us a very good presentation. We had a clinician, Professor Leo Schultz-Kuhl from Radboud UMC, and also 3 ERNs were represented and gave us their own perspective on the challenges. Bruna gave us a summary of the inventory on PROMs used by various ERNs, and I believe the link is also in the summary. Now, the challenges, there were many really, and I've just picked up some, like the cost to develop, the time and cost to develop, the reliability, quality, the coding, languages, translation, interoperability, accessibility, phenotyping. So as you can imagine, this is a mammoth task. That's why it's so important that we have this discussion together. Now, the summary of that workshop, Marco tried to capture the essence of it and the first observations. They all agree that we need to start early and to start thinking about these challenges now. We need to think about interoperability and use of ontologies now when they are developing new questionnaires for the ERNs. PROs and PROMs are very important to all stakeholders, that there's an issue about defining them, defining PROs and PROMs, making PROs usable for data analysis requires interdisciplinary collaboration. Use definition and tool to define the PROMs between ERN is heterogeneous, but we will look into that. There is room of improvements with lay ontologies. PROMIS was apparently a good candidate tool to achieve commonality, so that has been brought up. And there was a request for evaluating whether it could be a good tool to use. Lastly, there was a lot of participants said that we need to keep in mind the bigger picture and take a step back and reflect on the fact that the information collected through PROMs are going to be used meaningfully for patients that might be uncomfortable. So all of this might get too difficult, too technical, but at the end of the day, it's all about providing a good care for patients. So this is what we captured last time. We would like to thank, of course, all those who are involved in organizing these workshops. And we are really looking forward to having a constructive discussion with you today. Thank you.
Okay, thanks for this overview, very helpful. And if I may chip in a brief question, and if others have questions to get things clear from this presentation, please raise your hands. I'll Yeah, I have a list of participants here. So if on the one hand we talk PROMs, and you show the difference between PROMs, PROs, and PCOMs. So are we inclusive and doing PROMs, PROs, and PCOMs, or are we focusing on PROMs only? Is that something that we have an answer on already?
No, we don't. I mean, we are focusing on PROMs at the moment because we are at Duchenne and the FAIRification of Duchenne registry. We kind of started that work ontologizing PROMs, but that's in itself like what do we need to focus on PROMs leading to the PROs, the answers.
Yeah. Okay. So,
yeah.
Go ahead, Bruna.
Sorry, there was also this issue about the general PROMs and the specific PROMs. So there was this disease specifics that they have to be developed for that certain measurement, and you have the general ones, and that's where I think Leo mentioned PROMIS, because that is a general measurement accepted everywhere to measure like pain intensity and so on, but is not disease specific.
Yeah. Okay. Thanks. So hearing that, we have a focus on PROMs, where we distinguish, as Bruna says, generic and general and disease-specific ones. But we keep an eye out and have in mind that we also have PROs and PCOMs. Yeah, Marco.
Okay. Yeah.
Yeah, I wanted to share, because also in the context of the EJP, in the FAIRification task, we need challenges. And I was wondering if this issue of how specific do we go, how general do we go, can we cater for both? If we can make that a challenge for FAIRification. So rather, in addition to selecting PROMs and PROs and what to focus on, we can also highlight issues that we're going to address by doing this. That's what I wanted to share. So if you see that, if you see issues that we can put on our list, oh, this is a challenge that we need an answer for. And I think I've seen this come up multiple times, generic versus specific. So it seems that seems a challenge that maybe we can address in the context of PROs.
Can you rephrase for me the challenge, Marco?
How to deal with the desire first to be general, so that you have the same thing everywhere, but at the same time be specific enough to be useful for individual diseases. I would think it's an interesting challenge for an ontological approach.
Yeah. Okay. Thanks. Okay, this helped, Noel? You want to?
Yeah, no, it helps. Just I would like to throw a thought there, because we are talking about FAIRification, interoperability. When the starting point was a generic process for us, and that really helped us kind of be focused and knowing what to do, even though we didn't, but it gave us like the canvas to begin somewhere. And I'm wondering whether for this challenge of the PROMs and PROs, we could have something similar to help us think how to get there.
Yeah, and I think so. What you're saying is important. I think you said a generic approach, because what I would like to get clear, and maybe that's now a next step to take, is so when have we been successful? So what's our aim? And I mean, we have this now short series of workshops. At some point, I think we would like to say we're ready. But where are we when we're ready? Is that when we have specified the generic approach, or when we have applied the generic approach to each and every ERN, or anything in between? I think it will be good to have that clear. And it is indeed the generic approach, the thing that we're aiming for. happy to hear thoughts. I think that would be, I think if we have such an approach, and especially if we have an approach that we have demonstrated to be applicable and useful, then I think we are very successful. And we wouldn't have to apply it to each and every ERN. That's by intent the other extreme. So would that indeed be what we want to specify? And then have interoperable, ontologized, etc. prompts. Bruna.
Yeah, I have another tricky question to throw in. I don't know if Mark is in the call, but I was thinking we should, in the end, thinking of making things interoperable, yes, but also the reuse part of it, right? So that's why I make interoperable. And in the reuse part, we already have this semantic model for the CDEs, and that is quite generic. We are still working on the DCDs, so the disease-specific elements, whatever they may be. And I was thinking for these PROMs, we could also have a generic model that could fit any question. So the ERN could just change the URI of the question, and then that means that the model fits with the CDE model. And they just have to say what is the question that they have data on, like a URI for do I have pain or whatever, something like that. And we already have a draft of these with the Duchenne model and the one that Mark helped me for the PROMIS as well. So we could keep working on that. But also you have two questions after that question. Do we want to model every PROMS question, or do we want to model only the score, the final score of these questionnaires? What is the thing that the ERNs want to share and be interoperable with in the end?
Good question. And I think it's great to have an inventory of such questions, because I think these will be helpful to address along the lines. So I'm not necessarily saying that we should have an answer in this call, but we should have the question on the list as part of the process. So I fully agree that what you say, we should be able to integrate it within current modeling, and alignment with the CDE model would be, well, extremely useful. And indeed, we would need to determine whether we would want to be able to do it for each and every question, or rather for the, let's say, the high level outcome. So that's a question to put on the, let's say, on the process list to get an answer on. Thanks.
Maybe I can, yeah, maybe I can come back to what I said earlier, because that for me would relate to this, because we're also developing stewardship, and personally I think it would be nice if we can define for stewards the guidance on basically on using hierarchy in questions, to make people see that maybe a specific question is actually a more specific version of a more general question that more people have, and to guide people in this process and see how far we can get with that. I'm thinking of a previous work of Mark, where you probably, Mark, you remember this with BioMobi, that you allowed the community to define questions within a hierarchy, and it turned out to be one big flat list of question or of ontology terms at the same level, which then wasn't that very useful. So hierarchy didn't happen by itself. So it seems that needs to be a guided process, and maybe we can experiment with guiding that process. My personal, what I think is that ontology people think hierarchy. So it's not a problem for ontology people, but if you're not an ontology person, you probably don't think that way at all. So every question is an individual question. And I think it would be interesting to see if we can guide that process a little bit. Or actually not a little bit, quite a lot.
Yeah.
And yeah, so that's would be my input here.
Yeah, okay, thanks a lot. I see Kate has a hand up. Go ahead.
Hi, yes, hi. I'm Kate Hayes, and I'm here on behalf of the European Cystic Fibrosis Society, our clinical trial network, and we're working in partnership with CF Europe and my colleague Elise Lamartine, I think, is on the call as well. And they're the Federation of European Patient Organisations in Cystic Fibrosis. And I liked what Marco was saying there, because I think what we've done, we're working on a big project with expert patients, and it kind of ties in with a couple of points that you've raised. I think we need to consider patient-centred outcome measures. We've generated a new questionnaire and we're in the process of validating it with an expert patient group, and they have created it. But it was really the basis of a much wider European survey, and we looked at really all the tools and questionnaires that are out there that are used across European CF centres, and there were over 70 when we surveyed sites. And what we tried to do with the patient group was to strip those back to what Mark was talking about, the key themes and the key domains. So although we're creating a disease-specific questionnaire for use within cystic fibrosis, we've tried to, I suppose, find the skeleton of the key domains that would be useful, and I think useful at a more generic level, not just a disease-specific level. And perhaps as an output from this group, it might be useful for us all to maybe produce a template or put ideas forward onto a template where we could list those key themes and domains that would be useful going forward. So not just within a disease-specific PROM, but at a wider level across multiple specialties. Because within our clinics, it's not just disease-specific tools that were being used, but more generic ones like the EQ5D or the SF36. So very often it was a blend of tools that was being used, obviously for different purposes. But if we could perhaps come together as a group, I was talking to Simon Gibbs in ERN Lung, and we were trying initially to I suppose, find a key list of PROMs that would be useful for us. But the field is just so vast that it's really, as Marco said, probably more useful for us all to strip it back to those key domains that might be applicable across multiple areas.
Yeah. Yeah, that's like you say, it is a vast domain. So we, I think it's, I would say indeed having the demands or the requirements clear will be, well, helpful, if not necessary, to be able to scope this and to make this concrete. And I think let's say the inventory of what's out there is definitely helpful as basically for follow-up, that you know what the area is on which you would have to apply your well, either requirements assessment or the process to work with the PROMs and to make them available in an interoperable and reusable way. So I think that indeed trying to stick to generic a generic approach, acknowledging that the field is vast and that we need to cater for both general and disease specific well, PROMs, but also pros and PCOMs. I think, but I put it on the table, would be a good scoping for now, and that we would then have to work out. So I'm well, thinking and talking at the same time, which generally isn't the best idea. So I think it would be good to indeed say, okay, so we want to establish an approach or a process or a method to work towards interoperable, reusable PROMs. If we have that approach, and I would say if we have demonstrated at a small scale that this approach can be applied, I would say then we are largely successful, because then we have a method that we can basically repeat on a broader set of PROMs. Is that so, or are there other thoughts on what we would want to establish? from anyone. Nawel, may I ask you if this is what you would have in line?
I think it all makes sense, but I was a little bit confused by, I was reading the messages, and there's another one called PROMs, or patient-reported experience measures. So, wow, yeah. So we really need to define which problem we're solving, or which term, or so I didn't come across this one before.
Yeah, no,
Yeah.
I've heard of it, but I am aware that. So I think experience is more about the process, and well, outcome is about
Yes.
So, and I'll just read out so that we're in sync with the messages coming along. Mark writing. Verification of Duchenne PROMs. The question is easily modeled as an ontology term. This is really no different than a simple ontology terminology building. Ontologies are just formal captures of human agreement, and agreement on a question is just the same as agreement on any other idea. Yeah, so I think one of the steps that we need to address in the process is indeed seeing, okay, do we have 4 questions, ontology term, if you will, or annotation. And I think that's actually, but maybe that's too much detail already, one of the challenges that, and that relates, I think, also to the question whether we also only want the, let's say, the outcome measure, or also the underlying individual questions or items, if you will. I think for some PROMs, the individual items are, let's say, ontologized, or at least are provided with a standardized code. But I think for many PROMs, they aren't. And I think actually one of the challenges that we would also have to face is that I know that some of these questionnaires are proprietary. So, well, if you it would not necessarily, it may be challenging to ontologize them, because ontologizing might mean in a way exposing the underlying items, and if they are proprietary, we would have to negotiate with the owner of the questionnaire. So I think in terms of, we said interoperable and reusable, I think we also have to face the accessibility criteria and get into, well, maybe licensing stuff and things like that. So that's definitely not, well, at least not my area of expertise, but it is something that we will have to address for some, at least. So just to be aware of that. And again, I think it's something that needs to be acknowledged in the process, rather than to be solved in this, well, remaining 30 minutes. So I think this helps in creating the list of items that we need to address in the process for this series of workshops. And then, yeah, go ahead.
No, I would really like the participation of other technical brains who are here today, because it is a brainstorming session. And so I also wanted to know whether we could use what Kate has described. You know, clearly they've done a lot of work, and we not capitalize on that, or enhance, or start from, not from scratch, but from whatever good work has been already done. And to answer your earlier question, how do we know that we succeeded? Can we not, for example, take decide on a use case that we would work, something that is achievable, that we could work with, and try to demonstrate that we may make that case interoperable, reusable, and take it from there?
Well, I'll open the floor for feedback on that question. if there's agreement, if there's opposing views, if there are questions.
Can you repeat it once more, Navel?
Yes, I would like to know your. So basically, we are doing this work on PROMs, and the objective is to get to have interoperable PROMs and reusable. Can we start by thinking about a use case, an example, something that we could work with the FAIR expert to make this instrument or questionnaire interoperable, reusable, just like a pilot that we could work on. And
one idea that comes to mind, Navel, is that because I saw also on the chat that there are many examples of questionnaires from different groups, also on PROs, is that we could have a look at how if we look at them from a point of view of interoperability, would they be somewhat different? What guidance would we give if we really have a perspective on interoperability? I'm thinking, it seems to me that actually it's the main issue that we run into with the PROs is actually more convergence than interoperability. We can make, if all the questions are very different, we can do ontology terms and etc. But then what I understand is that we will have a huge ontology with a huge amount of slightly different questions at the leave nodes in the ontology, which would somewhat work, but maybe there's we need more incentive towards interoperability early on, choosing the same questions, indicating early on that a question relates to a more general question. And maybe we can actually use some of these existing questionnaires as a starting point, or as a sort of baseline or something. That's just the first thought. The other thought I had was that we've seen in other parts some examples of tools that help in choosing ontology terms and also identifying this linking it to other terms. And maybe something like that could be possible in a workshop, like metadata for machines workshop. It's a little bit like that.
Yeah. Yeah. So I think it's, well, there's a whole bunch of things, and I see support for the use case driven approach from I think from Lex. And I agree. I think having use cases will be very helpful to make it tangible. I think an important thing also with these inventories is to realize, and maybe I'm here having a slightly opposing view with Mark in the comment here, that it's not only interoperability among us and even among all 24 ERNs, but it's also interoperability in the larger clinical realm, and especially if and as there are PROMs that, well, have been made interoperable to some extent, for example, by being included in LOINC or something. I think it's largely important that we, within our process, or maybe I would say try to establish a process in which ideally I would say our role is as small as possible. Otherwise, what we are doing is basically creating our own interoperability bubble without the larger context. I see Mark raising his hand, so well, I think this is definitely an area to discuss, and maybe I'm framing your words in the wrong direction, Mark. But so I think what we need to take into account within this process is all of these elements, and see how we can, well, maybe not even how we can address them, but how we can have them addressed, and ideally, as I say, as much as possible by other parties, and then also up front. So whenever anyone decides that new PROMs are needed and are specified, that there's also an approach to do that in a fair way from the start. Because I think what Marco says, there may be, if we do an inventory, there may be many questions which are basically variations, but which are, well, very close to each other, simply because, well, they're either with a very good reason, or because, well, it wasn't known that a similar question was already specified in another PROM. So that would definitely be something that we would want to work on, but that's, well, really the larger process, which is outside our, well, span of control, but definitely something that we have to deal with. Mark, do you want to comment?
Well, only I'm a bit confused now about what your definition of interoperability is. Because what you just said is it's made interoperable because we put it into LOINC. I don't see that as a definition of interoperability. Interoperability is always human agreement. And how we formalize that and how we represent it for machines is a purely technical thing. But if we all agree on serine, threonine kinase meaning a certain thing, then we are interoperable. If we agree on urinary dribble as a PROM, we are interoperable. The structure within which we put that is kind of irrelevant with respect to trying to achieve interoperability in rare disease registries. I don't see that the inclusion in LOINC is, or any other ontology, is necessarily the goal. I think the goal is to agree on what it is we're going to ask and make sure that everyone asks it the same way.
Yeah. So what I was aiming for, so thanks for for bringing this up, is that we need to be, let's say, we need to be clear about the scope or maybe the span of required interoperability. Because Mark, if only you and I, the two of us, want to be interoperable, because we talk about, what did you say, urinary dribble, we can be interoperable among the two of us. But if we want to be interoperable about something that has a much larger span of, let's say, interest and relevance, then it would not just be a matter of you and I being interoperable, but us being interoperable with the rest of the world. And that's where I feel that we can't say, okay, we're interoperable because we created Mark and Ronald's ontology, so this is for all of the world to use, and I don't want to maintain that ontology for the rest of my life. And then I would like to go to LOINC and say, hey, LOINC, can you please cater for a code for this thingy? Because then we can share it with the whole world. So, and I think that is also something that we need to indeed address. And I know sometimes maybe people are trying to make things interoperable that only two people are using, or well, that basically no one, and I'm exaggerating, it will be reusing. So then it's an overly effort with little benefits. But the other way around also occurs, that people are interoperable among a too small group, and it doesn't scale to a broader community, which would also benefit from this interoperability. So with all of these things, I think we need to be clear about the realm or the span of interoperability that is being sought. Marco, you raised your hand.
Yeah, and sorry that I can't, my camera, because I think when I switch it on, you see black. Right? Oh, no, you don't see black anymore. So, okay, this camera is working. Yeah, it seems to me that we're actually pretty much on the same page. I thought maybe with a little example, I can stress again that I think it's useful to develop stewardship on this. And for instance, with in the Duchenne field, the well-known many fields, the 6-minute walk test or 6-meter walk test. So an example could be that, well, for my specific disease, a 12-meter test would be the appropriate test. And then in stewardship, you would have a discussion saying, well, do you really need a 12-meter test, or would 6 meters be okay too? Because then we are more interoperable with the rest of the world. And otherwise, because then in a way there's a penalty, but at the same time, when for some domains it's really important to do 12 meters instead of 6, you could still say, as a steward, you would say, oh, but it's still all mobility. You're still measuring a score for mobility. And there we also have we can link it to the more general question. I think this is I would like to see developed this process of guiding people in that way, so that people can do specific things when they really need to, but are persuaded to do the more general things when they can.
Yeah.
And I think there's also where loin comes in, right, Ronald? That's where we, as a steward, you would guide people to, oh, there's a loin code for something that is very similar to something that people want. We can then ask, is it actually something closely enough to this global term that we already have?
Yeah.
And then use that.
Yeah. Yeah. So I think there's two things, and indeed there is one is the challenge of addressing the things that already have been specified, and there will be challenges there. And the other is indeed the challenge of, maybe even, to put it bluntly, refraining from inventing new questions, but as much as possible, so unless it's really necessary, of course, but then as much as possible reuse existing questions. Like you say, Marco, if there's a 6 meter walk test, you can do 7 and 8 and 10 and 12, but you might wonder if there's really an added value in having that, or whether we could simply standardize on 6 meters. And if you feel there's another one, then indeed agree, okay, these are mobility measures that all go under the same category. Yeah. So I think these are all things that we need to take into account in this process, I think likely we'll stumble upon if we have a sufficiently apt use case. So I think picking the use case wisely is important, and I think I would say that with maybe a first next step would then be agreeing on use cases to work with while laying out the approach or the steps through which we want to specify the process. So I think, having use cases, from them specify a set of questions, specify a process, specify requirements to fulfill. I think that will be very helpful. And then indeed, if we end with having the process clear and demonstrating it, having demonstrated it for the use case, and the use case I think will be like cross ERN, so will include, let's say, 2 PROMs that are aligned, for example. I think we could define that as success. I now see Niru with even 2 hands up on my screen. I don't know how you do that, but
I don't know why there are 2, but I just want to ask Janus about his comment on Ordo. So you said that Ordo is extending to also functional annotations. You mean these outcome measures?
Yes, this is what Anna told me, and she just confirmed regarding the timeline on when it will be done. This will be provided by Anna, but they are planning to extend Ordo to include these functional annotations. And as she is the leader of this work in ERICA that is dealing with PROMs and more generally with clinical outcome assessments, she will provide more insights on this. Also, I provided because we are talking about the generic and specific prompts, this and the agreement on their use at least, but not on their ontologization. Work has been done by the Australian health system, and I have provided the link where they have provided a list of validated generic prompts and specific prompts for each disease area or classified by ATC, anatomical and therapeutic area. There, this might help also with this work.
Yeah, thanks. I was planning on doing exactly the same thing, Neri, to ask Yanis for the clarification. So
sorry, I was very curious.
Very helpful. And yeah, so I see we have some 15 minutes left. So I think, well, let's say the why is clear. I think the what we want to establish is getting clear as well. Then there's always the pressing question of, well, how to organize, whom to do that. I think we can all watch it now well and well, hope that he is willing to take a role in this, but hopefully there are also others who are willing to contribute. So, and I'd really like to put that as an open question. How can we take this further? How can we organize this? Because I can imagine for Nawel, but let me know. Either you say, well, I'm happy to take some next steps, or maybe you want someone to partner with to, well, because if we, well, like I was doing interoperability with Mark on urinary dribble, well, we might want to have a partner for you, Nawel, to a sparring partner on use cases and taking some further steps, and also the preparation and things like that. So because I think we need a little bit of structure on how to get this organized in terms of well, who is doing it, and then also on timelines, because so we want to have, do we want to have this ready like by Christmas this year, summer next year, or 2030, or anywhere in between? And I think likely anywhere in between, but it's good to try and make that concrete, because that will help for everybody to know what we're expecting. Nawel, do you have any thoughts on that?
Yes, thank you, Ronald. So I'm very happy to coordinate this, obviously, with the team, because I'm not doing it on my own. Niru, Bruna, Clemence, and others are involved as well, and we're helping each other. But it feels right to take this to Erica, to Anarath, because they are managing the PROMs and the work package 3, I believe. So we need to align our efforts and do it in a structured way, as you just mentioned. So my suggestion would be to go to them, tell them what we've discussed, and have their views on the subject, and hopefully have kind of clarity as how we are going to do this, which use cases, and report back. Does it sound good?
I think Mar is in the call.
Okay.
As you're the co-lead of Work Package 3 in Erica, do you have some thoughts already?
Hi, thank you. So yes, I was just listening, because actually the expert on this is Anarath, and I'm working with her to see how we can promote this in the context of the ERNs. And no, we don't know yet the use cases that we'll want to implement. The idea is that by mid next year, we'll have the outcome of the exercise that we are doing on mapping rare diseases based on the functional impact of rare diseases, and cluster the diseases based on their functional impact. And then we are now doing this, and then the next step is to codify the database that we have on PROMs. So the idea is to codify these PROMs according to this functional impact of rare diseases. and to prioritize and see which PROMs we want to implement for rare diseases. Actually, yesterday we had the steering committee of ERICA, and we discussed with other groups, especially with France for registries and with Luca for clinical trials, to see if we can start identifying potential use cases for the implementation. But the idea is to not to start with this before next year, when we have the outcome from the clustering analysis. I don't know if I am clear, or if you are aware of what we are doing with this clustering analysis.
Well, I'm not exactly, so I think that is something to maybe follow up on. But if I hear you correctly, I think this is definitely something that does require alignment with the other work going on, and actually it also sounds to me like a lot of the work that we're planning on doing here is actually preparatory work that would help you in taking up the steps that you are planning to take as of next summer, if I heard you correctly.
Yes, sure. So actually, when I'm new in this field, but when I saw that you are doing these workshops, I'm participating, of course. And what I realized is that there are these not overlapping, but of course, this complementary of the tasks that you are doing. And this is what we want now, to see what you have done so far, because we wanted also to do a survey among the ERNs. And I know that you did one, I think last year maybe, but I want to double check with you the results from this survey, what was the scope of the survey, to see if there is the need to do another one or not, and then to identify use cases that are ongoing or that are planned to be launched in the next year for ERNs regarding implementation of PROMs. But for sure that we need to do this to have these synergies.
Yeah. So this really sounds indeed synergistic. So my proposal would be that it would be great, Mar, if you could at least spar, or for now partner with Noel to make sure that indeed the work within this group and the work that you're just mentioning and explaining are aligned and synchronized, to prevent that we go in different directions, or that we overlap, which would be a waste. Because I think that would be very helpful also in scoping the work we're doing here. And in specifying the timeline, because it would help to say, okay, so for the work that you're specifying, and starting from next summer, that would be kind of a natural deadline then, to say, okay, by that time we have some version of a process that we can then apply to the context that you described.
Sure. Yeah, sure. I think that if you agree, we can have a video conference with Noel, so we can see in which point we are. And for me, it will be really very, very useful, because I am like the link with the ERNs. But for me, it's, as I told you before, a new field, but yeah. I want to learn and to help on this. And Anna is leading this part of the labeling of the PROMs and all the work, but it's really very, very interesting, and I will be very happy to team up with you for promoting this in the field of the ERNs.
Yeah, well, that's excellent, and that's very much appreciated. And I see Noel nodding. So yeah, so I think indeed, if at least Noel and you can get in touch, and indeed maybe connect with Anna as well to both get you, Mar, up to speed on all the things going on, because I can imagine it can be fully overwhelming if you just get into this field and all the things going on. So there will be a lot to learn, definitely. So,
yes.
but we are in a learning organization and a learning program. So, okay, thanks, Mark. So yes, I think for you, hopefully it's also a great opportunity to do a lot of learning. And then sure. I think it would be very nice if, because we have a next workshop planned for November 18, top of my head.
That's correct, yes.
Yeah, if by then we would have a kind of an outline of indeed what our aim would be, what the time frame would be, and then maybe also the steps towards that, because that would mean that we can then either in the next workshop go through that as kind of getting everyone up to speed on the steps that we want to take, or and that's open if possible, we already start doing a first step. So, and either approach, and I'm happy to leave that with Navel and Mar and others to see what would be feasible. But then to say, okay, so these are basically the steps that we want to take. And so first we maybe do a round of requirement solicitation, or we do, well, whichever, and then from that fill in the process that we would like to have by likely somewhere mid next year, to be then applied to the cases that Mar described.